Now we want to get the latest updates from the head of the St. Louis Metropolitan Pandemic Task Force. Dr. GARZA is also the Chief Medical Officer for SSM Health and joins us live. Dr. GARZA, let's jump right into that latest information. As we reported at the top of the newscast, the task force reports 3 new records set in the last couple of days. So how concerned should we be about that?
Well, very concerned. I think when you look at the graph, when you look at the slope, those numbers have increased pretty significantly in a very short period of time. So we've never really seen that sort of growth that fast throughout the pandemic. And so the question is really, how high is it going to go and how fast will we get there? And this doesn't just impact patients with COVID, this impacts all patients, because if hospitals are full taking care of COVID patients, that means less availability to treat all of those other medical conditions that are still out there. So that's really the concerning part.
And the latest figures show an uptick in vaccinated people being hospitalized, going from about 25% to about 33%. Why do you think that's happening?
Yeah, it could be any of a number of things. By and large, most people that are being admitted to the hospital that have been fully vaccinated are people that have other healthcare conditions that make them immunocompromised. So think about patients like cancer and other sorts of diseases that really impact their immune system. So we've seen some ebbs and flows in the percentage of people that have been admitted that have been fully vaccinated. So it's hard to see if this is a trend or if this is just a one-time blip. But I think the important message to take home is, without a doubt, the majority of people that are admitted to the hospital are the unvaccinated.
And as we're talking about the number of people being admitted to the hospital, Dr. GARZA, are we at a point where we need to prepare to find other places to treat people, setting up makeshift hospitals at arenas or even the convention center?
I think we're getting close to that. Now, the challenge then is, where do you find the staff to take care of places like that, to be able to man places like that? The reason why I say that is we have more and more people in our own ranks, in our own facilities, that are coming down with COVID and having to stay away from work. So really the rate limiting factor is the workforce. It's not so much space and stuff, it's people. So it's a little bit odd to think that we're actually decreasing capacity because we're decreasing our number of staff.
And on that note also, as grim as it may sound, is there a point where hospitals will have to prioritize treating people that are vaccinated over the unvaccinated, especially when we're in a position where the vaccinated people have a better survival rate?
I don't think that we'll ever get to that point. But I do believe that we'll get to a point. Well, let me put it this way. We're getting closer and closer to what we would call crisis standards of care, where we would have to triage people in order to save the most amount of lives with the limited resources that we have. Now, we never want to get to that point, which is why it's important for everybody to continue to get vaccinated, wear masks, all of those things. But it certainly puts us at more risk for reaching that level with the trajectory that we're on right now.
Okay, Dr. GARZA, always appreciate you taking the time with us in the afternoon. Thank you so much.